Before taking a sample, make sure you positively identify the patient. Identification generally requires asking the parent or guardian to verify a minimum of 2 identifiers, such as first name, last name, and date of birth of the baby. Some institutional guidelines recommend you consider swaddling the baby or administering a small amount of oral sucrose prior to the procedure. Sucrose has been shown to have a mild analgesic and calming effect. Always follow the specific guidelines recommended by your institution and consult with the primary caregiver. You may also consider warming the sample site. This has the effect of increasing blood flow to the area and may be particularly helpful when sampling for tests that require a larger blood volume. To warm the site, cover with a warm, moist towel or other warming device with a standardized temperature of up to 42 degrees centigrade or 107 degrees Fahrenheit for 1 to 2 minutes. Be careful not to scald the infant or baby. Disinfect the sampling site using the method recommended in your institution's guidelines. Allow the area to air dry. If you're using alcohol to disinfect, make sure it is fully air-dried before performing the procedure, as alcohol can cause inaccurate results by hemolyzing the specimen. Grasp the heel using the correct hold to avoid bending the foot back towards the shin, which could cause injury. Press the safety lancet or heel incision device firmly against the heel. Activate the lancet by pressing the button. The needle or blade will puncture the skin very swiftly, then automatically retract into the device to prevent reuse and needle stick injury. Once the lancet has been used, dispose of it by placing it into a biohazard sharps container. The used device must not be disposed of in a regular waste container. The colour of the sharps container will depend on your local region's guidelines. After you have made the incision, wipe away the first drop of blood with a clean gauze pad. This will help to avoid specimen dilution with interstitial fluid, which can lead to inaccurate test results. Some tests do not require this step. Therefore, check your institution's guidelines to verify which tests require the first drop of blood to be wiped away before collection of sample for testing. Depending on the test, you can use a variety of methods to collect the blood sample. If you're using blood collection paper, allow a large drop to form. Carefully fill each circle from the front side of the card, using only a single drop of blood. Avoid touching the heel to the blood collection paper while applying blood to the circle. If you're using a capillary tube, hold one end horizontally and touch it to the blood droplets at the puncture site. Fill the tube while trying to minimize air infiltration and air bubbles in the tube. Gently massage the heel to maintain a continuous blood flow. When sufficient blood has been collected, place caps on both ends of the tube to allow for mixing and to minimize air contamination. Be careful not to use a scraping or scooping motion or squeeze the heel too hard, as excessive pressure can cause test result errors. Some of the pre-analytical errors include hemolysis, dilution of the specimen, and obstruction of blood flow. Squeezing the heel too hard may also increase discomfort for the baby and increase the risk of bruising. Alternatively, you may need to collect the sample in a specially designed collection tube by allowing blood droplets to drip and flow into the tube by natural capillary action. It is also important not to use a scraping or scooping motion here. When you have finished collecting the blood sample, use a bandage to cover the wound. Collection tubes contain certain additives specific to the test or tests for which they are designed. You will need to ensure that the collection tube is filled to the right level to enable a mix of blood and additive. Under or overfilling the tube can also lead to inaccurate test results. It is important to gently mix the blood and the additive well. To aid this process, it may be helpful to gently swirl the tube after each drop of blood is collected. Once you have collected the necessary amount of blood, you should carefully invert the tube 5 to 10 times to ensure that specimen and additive are well combined. Do not shake the tube, as this causes hemolysis. Failure to mix well immediately after collection, or under or overfilling the tube, can lead to specimen rejection and test result errors. For test-specific information on storage temperature, handling, processing and testing of the capillary specimen, refer to your institution's guidelines. It is generally recommended to analyze the specimen promptly. Sample with confidence with the Unistick range of single-use safety lancets, and sample right first time.